So, I mean, the trite answer to that question is, do you have 6 hours? Because there are so many hurdles that we need to consider. I guess the first challenge is, what can you safely target? I told you about an ERB targeted CAR that we're developing called T4 immunotherapy, but the ERB receptors are expressed at low levels on many healthy tissues. And so we put these CAR T cells directly into the tumor as a device to de-risk. Safe tumor-specific targets are very difficult to identify in solid tumors, and we need to think about either identifying new targets or indeed patterns which are characteristic of a tumor, which we can exploit using an cellular engineering approach. The second issue we have is, how can we actually get these T cells to find the tumor? When you're treating a blood cancer, you put CAR T cells into the bloodstream and they have direct access to malignant cells. And malignant cells in blood cancer will also be found in bone marrow and lymph nodes, and these are places where T cells naturally migrate to. Solid tumors, on the other hand, are found in parenchymal tissues, liver, lungs being two of many examples. How can we get T cells to traffic in order to identify localized tumor deposits? The third issue is, let's say we overcome these hurdles. We have a target that we think is safe, and we have a strategy to get these T cells to migrate into tumor deposits. If they manage to do that, they will encounter an extremely hostile environment. We talk about the tumor microenvironment, and this is a microenvironment which is all about switching off immune responses. People have compared solid tumors to wounds that never heal. And I think this is a very nice analogy, because during wound healing, you don't want to have an active immune response going on. So it's all about damping down that kind of inflammatory reaction. And solid tumors hijack this using a range of physical, chemical, and biological barriers, which switch off CAR T cells. So in a nutshell, those are the main issues that I identify in trying to tackle the thorny problem of solid tumors.